All right, some of the things we want to talk about are causes, symptoms, then we'll talk about treatments, and also we'll talk about risk factors in part 2. So part 1, everybody wants to know what causes kidney stones. It's basic chemistry. If you don't have the proper substances to keep these crystals from forming in your kidneys, you will probably end up with kidney stones. What happens is the calcium and uric acid tend to bond together and they start building and building and building. All right, and that will then in turn create the symptoms that we often see with kidney stones. Pain, pain, and more pain. I've seen people on the examination table, you just touch their back and they're jumping off the table and they cannot stand to be around anybody. They're miserable. Anyway, so you're going to get side pain, you're going to get back pain. It's all going to be located below the rib line. Sometimes it'll radiate. The thing that you're dealing with though is pain. That's number 1. 2, your urine will change color and might also change an odor. So if it starts to smell differently or it starts to look differently, you probably have some problems in the area. Second, you're probably going to be in so much pain that you're going to be dealing with the symptoms of nausea and vomiting. Lastly, but not totally, fever and chills often accompany these symptoms. Why are you going to go see a urologist? Well, they're specialists in this area, that's why. And let's also remember, if you're in so much pain, severe pain, that you can't find a comfortable position to lie down to rest, you're going to want to see someone immediately. You're almost always in constant pain. You want to get this treated as quickly as possible. All right, what else are you looking for? You want to make sure that the doctor can detect if you have blood in your urine, where it's coming from, how it's being produced, that kind of thing. Difficulty urinating. This is a biggie. If your bladder is backing up, you're going to cause problems in your bladder, your urethra, and other areas of your body as well. You could go toxic pretty quickly. So you want to make sure you get to a doctor. This is an emergency type of thing. Nausea and vomiting. And finally, fever and chills. If you're feverish, you've got chills, there's something wrong. Go see your doctor. And in this case, a urologist who can treat you immediately.